It's been almost a year since they came in 100 and received with open arms. Many were puzzled about what new things they would offer the country despite having already very competent doctors in Kenya. It's none other than the Cuban doctors who were clustered into family doctors and specialists. However, the unfortunate abduction of the two Cuban doctors a little over a month ago from Mandera County sent panic. Dr. Acel Herrera and Dr. Landy Rodriguez are still in the hands of a militia group, forcing the government to withdraw the Cuban doctors from 4 other counties, including Isiolo, Wajir, Garissa, and Lamu, with fears of an imminent threat. Now, with rescue efforts still ongoing, we prepare for you a scorecard of the other doctors in other counties. How have the services gotten to the patients who need them the most? And most importantly, have they had any impact? Saida Swale visits 3 different counties just to understand the modus operandi in this special feature, Beyond the Hospital.
Our story takes us to Kwale County, Matuga constituency. At the Matuga Health Dispensary, we find the clinical officer in charge updating Dr. Milagros Sotelo, a Cuban doctor stationed in Kwale County as a family doctor, about the state of Mzee Mwanzi. You see, the Mzee has been ailing for a while, and medical expenses are taking a toll on the family. Cuba. He can no longer move to the health facility. This is the first time Dr. Sotelo is meeting the family. She is worried about the reception. Mzee Mwanzi has a urinary tract infection and is often unable to pass urine, a condition that has confined his wife Asha Thumani at home. She put her life on hold to be by her husband's side, emptying his urine bag and being by his side. It hasn't been easy, she tells us.
Mara neturauke twende Sambweni. Tukifika daktari tumemkosa kwa sababu ni wale madaktari kuja asubuhi. Tukifika huko mara tumechelewa kwa sababu ya magari. Turudi nyumbani.
Asha considers herself lucky. Every time Mzee would need urgent attention, the clinical officer would offer his motorbike to ferry him there. But when the officer is unavailable, the cost is theirs to meet. Now, a doctor has come to her home, an unusual occurrence.
Nimejua huyu daktari ni daktari mkubwa kule Msambweni. Huwa hapatikani ovyo ovyo daktari. Huwa hapatikani. Nimefanya karibu mara 3 nikipeleka Mzee yani ili akachekiwe katika ule mpira wake. Nikifika nimechelewa na gari.
He told me that they are on medication for...
Dr. Milagros understands that not all patients introduced to her are familiar with the home visits, but as a family doctor, she must be flexible to work out of the hospital.
I can see this is 16th of August.
The field is her playground and the community her responsibility, just as she would do it back in Cuba.
Na daktari akija hapo nyumbani amekuja hapo nyumbani kukutibu wewe ama kuangalia mgonjwa wako. Tena shukuru kwa Mwenyezi Mungu. Shukuru sana kwa Mwenyezi Mungu.
When Dr. Milagros arrived here, she was attached to a team that was already familiar with the area. This helped in identifying the patient's needs. So when it came time to meeting the patients like Mzee Mwanzi, it was a breeze.
Tumeweza kuidentify wale wagonjwa ambao mostly ni chronically ill, hawawezi kujileta hospitali. Cuban doctor alipokuja, tuliwa map wale wagonjwa wetu. Tukawa identify, so tumekuwa tukiwatembelea sisi pamoja na huyo daktari.
Her next stop is Mkongani village. Here, locals are forced to walk almost 30 minutes to the nearest health facility. But before they pitch camp, they make a stop to collect medicine for the patients. It is almost 3 kilometers from this village to the nearest health facility in Mkongani area. It would have become almost impossible for the Cuban family physician to establish patients who are in dire need of her services, were it not for the linkage that exists between the community health volunteers and the health facility. This then ensures a proper primary healthcare system that is efficient and affordable.
Yule aliyoko kule hospitali hajui kijijini kwaendelea nini. Lazima apitie kwangu ndio ajue huku kijijini kwaendelea nini. From community health volunteers to Halima, to the nurse, to the nutritionist, and to Kwale and like that.
I'm never alone, so I always have help, always. It's Halima here with me. The health community worker.
How are you?
I'm okay.
How are the days?
How is Mama?
It's Mona Asha's turn to be attended to, but Dr. Milagros is not a stranger to them. Halima had already identified her case and brought it to the doctor's attention. She had been living with a uterine problem for over 10 years.
Ule ugonjwa huu kwanza ulikuwa matatizo sababu haujulikani. Kwenda hospitali hapa nasoma ni mishipa. Wapigwa madawa lakini hauponyi.
Kwanza kuna ile personalized attention ya kwamba Dr. Mila akija hapa yuko specifically because of this client.
I need to get the concern of the patient first. If the patient want, okay? Sometimes they don't want, but at the beginning, but with time we get the concern. When I saw the patient, I need to see how is the family and the condition of the house, because I need to see the risk factors too.
We're told that it's the county that has managed the highest number of outreaches with positive outcomes in Kenya, Bomet County. This has been their mode of transportation to get to the people. Even before the Cuban doctor was posted here, 4 times a week they go through the same routine that begins at the Longisa County Referral Hospital. A siren is then switched on as they approach the village, a reminder to the patients that today the hospital has been brought to the village.
The first thing we do is send a schedule with the area MCA, and then when we are going, we use the Beyond Zero itself as a siren, so it will help us call those people who did not get the information from the MCA.
Ikifika tu kila mtu anapiga simu, gari imeingia. Kama mtu alikuwa anajua wewe ni mgonjwa anakupigia simu, unakimbia. Then wanasaidiana tu kuspray na simu. Alafu unapata tu habari, unakijitayarisha, unakuja kama ulikuwa na problem yoyote.
Gogo has heard the call. She tries to prepare herself swiftly. She cannot afford to miss an appointment with the doctor, but age has crept in. She can only move as fast as her body allows her. She finds her clinic book and out she goes.
The Cuban doctors, mostly when she arrived, she took us through how it is done in Cuba. They don't only believe in the medicine, they also believe in the herbs.
And one by one, the villagers make their way here. Young and old, the queue is growing fast.
Like a place where we are now, Changina, it takes people around 200 shillings to go to Longisa and back. So we don't only measure on mother-child care, we also do deal with the people in the community who cannot access the nearest facility.
The dispensaries ziko mbali kiasi, na tusamani njia ilikuwa mbaya na hatukuwa na lile gari. Sasa nikiwa mgonjwa siwezi pata assistant, itabidi niende na mguu alafu nipande gari nikienda.
People in the village never saw the doctor every month. And when the patient have the treatment free, the patient do the treatment, and the patient prevent the complication of all the disease.
For the patients who have become accustomed to the door-to-door service, the headache for them now is what their fate will be after the Cuban doctor's 2-year contract expires.
The community feel that I'm not a foreign doctor. Now I feel like a Kenyan.
Okay, ma'am.
The Cuban dose brought about 47 family physicians and some specialists that were to be based at the county level. Dr. Michael Rodriguez is the neurosurgeon based here at the Jaramogi Oginga Odinga Teaching and Referral Hospital. He is facing several challenges here. There has been a sigh of relief for patients living here in Kisumu County and other neighboring counties after the posting of the Cuban neurosurgeon here at the hospital. This is the first time that a permanent neurosurgeon has been based here, therefore reducing the overall cost of healthcare for the patients.
And that has reduced the level of referrals. Actually, what now we are doing is to increase the scope of neurosurgery services by trying to get equipment so that we totally reduce our dependence on Moi Referral Hospital. Hospitals have around 10 counties, which means that there were a lot of problems in terms of the cost of illness, because it's not just the actual surgeries, but people have to stay in hotels when they go those sides, and in our situation, people have to be visited. Now, the total cost of ill health as far as neurosurgery burden was concerned was so huge that has now reduced.
I saw in a day around 40, 48, 50 patients. In 1 week, I'm working Monday to Monday.
When I look at our statistics, he's been doing around 200 major surgeries now for the last 6 months.
He also has students pursuing surgery under his wing.
For 7 months, I training. There are 3 resident general surgeons, and now they can do a surgery alone, principal emergency surgery. But the another surgery, for example, for tumor, spinal cord, they need my help. They cannot do alone. But I know I can sleep well because I know another people can help the Kenyan people.
For the 5 counties that had their Cuban doctors withdrawn for security reasons like Lamu, Wajir, Garissa, Tana River and Isiolo, the Kenyan doctors have taken charge to perform the life-saving surgeries scheduled for the patients. These are the counties that already had a deficit of specialists.
Kaunti yetu kama ina uwezekano badala sisi tukuishe hivyo waweze kutafuta daktari mwingine ambao waweze kutusaidia hapa hivyo.
The Cuban doctors have amplified the work of Kenyan doctors, with some already learning the Cuban ways. The downside of this program is that these doctors cannot reach all the patients within the counties served. Also, some patients are still hesitant about the services they render. And the issue of how this system of door-to-door healthcare will continue when the Cuban doctors go back home has not been addressed. But for now, there is no denying that for these foreign doctors, healthcare has sent them beyond the hospital. Saida Swale, Citizen TV.